welcome to this deep dive into the world of anal fissures and fistulas.
It sounds a bit intense.
Well, hopefully we can make it approachable. We're going to explore the sources you've provided,
Right.
looking at both conventional medical treatments and some potential benefits of natural approaches,
Okay.
particularly honey and fasting.
Interesting.
Some sources suggest that ancient remedies might have a place alongside modern medicine.
It's fascinating how honey, for example, has been used medicinally for centuries, long before modern antibiotics.
Yeah, I'm curious to hear more about that.
Yeah.
But before we get into the specifics of honey, can you give us a clear understanding of what anal fissures and fistulas are?
Sure.
What are the key differences?
Absolutely. To put it simply, an anal fissure is a tear in the lining of the anal canal,
Okay.
often caused by straining during bowel movements. It
Mhm.
can be incredibly painful.
Yeah.
Fistula, on the other hand, is an abnormal tunnel that develops between the anal canal and the skin around the anus.
Okay.
These usually develop because of an infection.
So, while both sound pretty uncomfortable, they stem from different causes.
Yeah.
What about symptoms?
Yeah,
Are there ways to tell them apart?
definitely. With a fissure, you'll likely experience sharp pain during and after a bowel movement,
Oh, wow.
and sometimes even bleeding.
Okay.
Fistulas, however, often cause persistent discharge, pain, and swelling. If there's an infection, you might even experience a fever.
That helps to paint a clearer picture. Now let's talk about honey.
Yeah.
It's something most of us have in our kitchens,
Right.
but using it for anal fissures and fistulas seems a bit unusual.
Uh-huh.
Is there any scientific evidence to support this? Or is it just an old wives' tale?
It might seem surprising.
Yeah.
But there's actually quite a bit of science backing up the use of honey for wound healing, especially for these conditions.
Okay, I'm all ears. What makes honey so special in this context?
Honey has several properties that make it particularly beneficial.
Okay.
Firstly, honey has natural antibacterial properties.
Interesting.
It contains hydrogen peroxide, which you might recognize as an antiseptic, and other compounds that fight bacteria.
Okay.
This is crucial because the anal area is prone to bacterial growth due to its location and the nature of these conditions.
That makes a lot of sense. So honey acts as a sort of natural disinfectant.
Exactly. But that's not all. Honey is also a natural anti-inflammatory.
Okay.
It can help reduce the swelling and pain associated with both fissures and fistulas. And remember, we talked about fissures being tears.
Yeah.
Well, honey can help with that too.
How so?
The natural sugars and enzymes in honey keep the area moist,
Okay.
which is incredibly important for promoting tissue repair and preventing further tearing. It acts like a protective barrier that also encourages healing.
So it's like a natural bandage with added benefits. Are there any other ways honey helps with these conditions?
One more thing. Honey also has analgesic properties.
Oh.
It can soothe the area and reduce pain and discomfort, which are major concerns with both fissures and fistulas.
That's quite a list of benefits.
Yeah.
But applying honey to that area seems a bit messy and potentially counterintuitive.
Yeah.
Are there any practical considerations?
You're right. It's not as simple as just slathering any honey on there. It's essential to use medical-grade honey.
Got it.
This type of honey is purified and sterilized, making it safe for these purposes.
So not the honey bear from the supermarket aisle.
Right.
What about application?
Before applying the honey, gently clean the affected area with warm water. Then apply a thin layer of the medical-grade honey and cover it with a clean bandage. This protects the area and keeps things clean. It's usually recommended to reapply the honey, especially after bowel movements.
That seems manageable. Now, these sources also mention fasting as a potential strategy.
Okay.
I know fasting is trendy for weight loss and other benefits.
Yeah.
But how does it relate to anal fissures and fistulas?
Fasting doesn't directly heal fissures or fistulas,
Uh-huh.
but it can be a supportive strategy.
Okay.
Think of it this way. Fasting gives your digestive system a much-needed break, reducing the frequency of bowel movements.
Yeah.
Fewer bowel movements mean less strain on the anal area, giving it a chance to heal.
So it's about minimizing irritation and allowing the body to focus on repair.
Precisely. There are different approaches to fasting. Water fasting, where you consume only water for a short period,
Right.
is a more extreme option.
Yeah.
It minimizes bowel movements but needs careful consideration.
Right.
A more common approach is intermittent fasting, which involves cycling between periods of eating and fasting. This can help regulate bowel movements and reduce pressure on the affected area over time.
Both approaches aim to reduce strain, which seems to be a recurring theme here.
Yeah.
Are there any precautions people should take if they're considering fasting?
Absolutely. Hydration is crucial, especially with water fasting.
Of course.
You don't want to become constipated, which would defeat the purpose.
Yeah.
And when breaking a fast, reintroduce food gradually
Okay.
to avoid shocking your digestive system.
Good points. Now, we've talked extensively about honey and fasting.
Yes.
But these sources mentioned a few other natural remedies. Can we delve into those as well?
Of course. One remedy with a long history of use is black pepper.
Black pepper. That's surprising. What's the reasoning behind using that?
Traditionally, it's been used for pain relief and healing.
Right.
While the scientific evidence supporting this is limited, it's been a part of traditional medicine for generations.
Interesting. What about other remedies?
Olive oil is another option.
Mm-hmm.
It can soothe inflammation and act as a protective barrier, much like honey.
Uh-huh.
And then there's garlic, which is known for its antimicrobial properties.
Okay.
It might help prevent infections, but you have to use it cautiously to avoid irritation.
So, a mixed bag of possibilities with varying degrees of scientific backing. It seems like exploring natural remedies requires a balanced approach.
Precisely. And that brings us to a crucial point.
Okay.
While these natural remedies can be helpful in managing symptoms, they're not a cure-all. This is especially true for fistulas.
That makes sense. The sources were very clear that sometimes surgery is unavoidable, especially for fistulas. Can you explain why that is?
Fistulas often require surgery to remove the fistula tract entirely, allowing for proper healing.
Okay.
Natural remedies might help with symptoms, but delaying surgery can lead to complications like recurring infections and even more serious conditions.
So it's not a matter of choosing one approach over the other.
Right.
It's about understanding the role of both conventional medicine and natural remedies,
Yes.
and when each is appropriate.
Exactly. And this is where seeking professional medical advice becomes absolutely essential.
I couldn't agree more. It's tempting to try and manage things independently, especially with sensitive issues like these. But professional guidance is crucial when it comes to your health. What are some things people should consider when exploring these options, particularly the natural remedies?
Allergies are always a concern. Before applying anything topically, even something as seemingly harmless as honey, do a patch test first.
Okay.
And speaking of honey, always use high-quality, pure honey to avoid any contamination.
That's good advice.
Yeah.
Anything else?
The most important thing is to never self-treat, especially if you have any underlying health conditions.
Right.
Always consult with a healthcare provider before starting any new treatment. They can assess your individual situation, weigh the potential benefits and risks, and develop a personalized plan that is safe and effective.
Solid advice. So far, we've covered understanding these conditions,
Yes.
exploring natural remedies,
Right.
and emphasizing professional guidance.
Yeah.
But what about preventing these issues in the first place? Are there things people can do to minimize their risk?
Absolutely. Preventative measures and ongoing care are essential.
Like what? What kind of lifestyle changes can help?
Diet plays a huge role.
Okay.
A high-fiber diet with plenty of fluids is key to preventing constipation,
Right.
which is a major contributor to anal fissures.
So load up on those fruits, veggies, and whole grains. What about other preventative measures?
Hygiene is also super important. Keeping the anal area clean and dry can help prevent infections and promote healing. And warm baths, or sitz baths, can soothe the area and reduce inflammation.
This is all great practical advice. Before we move on, let's quickly recap the key takeaways so far.
Sure.
Honey and fasting show promise as complementary remedies for managing symptoms. But professional medical advice is crucial, especially for fistulas,
Right.
which often requires surgery.
Exactly.
And while natural remedies can be helpful, it's crucial to use them responsibly and under the guidance of a healthcare professional.
Well said.
There's definitely a lot to unpack here. Let's continue exploring this topic further.
You know, as we delve deeper into these sources, I'm struck by the fact that we're discussing conditions that people often find embarrassing to discuss.
Yeah, you're right. There's definitely a stigma around anal fissures and fistulas,
Yeah.
which can prevent people from seeking help or even talking about their symptoms. It's a shame because, as we've been learning,
Right.
these are fairly common conditions.
Yeah.
And there are effective treatments available, both conventional and natural.
That's a good point. The more we talk openly and honestly about these issues,
Yeah,
the better equipped people will be to understand and manage their health.
absolutely. Speaking of natural remedies, earlier we discussed honey and its many benefits.
Yeah.
I'm curious, are there any specific types of honey that are particularly good for anal fissures and fistulas?
That's an excellent question. And the answer is yes. Manuka honey, which comes from New Zealand,
Okay.
is often praised for its powerful antibacterial and wound healing properties.
Manuka honey, I've heard of that. It's supposed to be quite special, isn't it?
It is.
What makes it stand out from other types of honey?
It has a unique compound called methylglyoxal, or MgO.
Okay.
This compound gives Manuka honey a much higher level of antibacterial activity compared to other honeys.
Interesting.
There's also growing research supporting its use in wound healing, including for anal fissures and fistulas.
So it's not just hype. There's science behind it. Would you recommend someone specifically seek out Manuka honey if they're considering honey for these conditions?
It's always best to discuss it with their healthcare provider,
Sure.
but given its higher antibacterial potency, Manuka honey could be a good option, especially if they're dealing with an infection or are prone to infections.
Yeah, that makes sense.
Yeah.
It's fascinating how we're seeing these natural remedies, like honey, being used for generations, passed down through traditional practices.
It really speaks to the wisdom found in traditional medicine systems worldwide.
Yeah.
Not every traditional remedy has been scientifically validated,
Right.
but many have, and honey is a great example. It's a reminder that sometimes the answers to our modern health challenges can be found by looking back to these ancient practices.
It highlights the importance of keeping an open mind and exploring both conventional and complementary approaches to healthcare.
Exactly. Now, going back to what we discussed earlier, you mentioned that fistulas often require surgery. Can you walk us through what that involves?
Of course. The most common surgical procedure is called a fistulotomy. In this procedure, the surgeon cuts open the fistula tract, allowing it to heal from the inside out.
That sounds straightforward, but I imagine it's not always that simple.
You're right. The complexity depends on the location and severity of the fistula. If it's close to the sphincter muscles, which control bowel movements, a more complex procedure might be needed to avoid damaging those muscles.
I see.
So it's not a one-size-fits-all approach.
Exactly. Each case is unique, and it's crucial to consult with a qualified surgeon who specializes in treating fistulas.
Okay.
They can assess the specific situation and recommend the most appropriate course of action.
We've focused a lot on fistulas, but let's go back to anal fissures for a moment.
Sure.
What are the conventional medical treatments for those?
The first line of treatment often involves lifestyle modifications,
Okay.
similar to what we talked about for prevention, increasing fiber intake, staying hydrated, and avoiding straining during bowel movements can significantly help fissures heal.
So it's all about making those bowel movements as smooth as possible. What happens if these lifestyle changes aren't enough?
Yeah.
Are there other options?
Absolutely. There are topical medications that can help. Nitroglycerin cream, for instance, relaxes the anal sphincter muscles.
Interesting.
And topical anesthetics can numb the area and provide pain relief.
It seems like a combination of lifestyle changes and medication can be quite effective in many cases.
That's right. But if those measures don't work, there are other options like Botox injections, which also relax the sphincter muscles, and surgery, which is usually reserved for chronic fissures that haven't responded to other treatments.
Botox for anal fissures. That's not something I would have expected.
It might seem surprising, but it can be very effective. Botox temporarily paralyzes the sphincter muscles, allowing the fissure to heal without constant pressure and tension.
So whether we're talking about fissures or fistulas, it seems there's a whole range of treatments available, from simple lifestyle changes to more advanced medical interventions.
That's correct. The key is to tailor the treatment plan to each individual's needs and circumstances.
This reinforces the idea that there isn't a single solution that works for everyone.
Right.
Open communication with a healthcare provider is essential.
Absolutely. It's a collaborative process.
Yeah.
What works for one person may not work for another. It's about finding the right treatment plan that considers the individual's concern, goals, and preferences.
And that plan might include conventional medicine, natural remedies, or a combination of both.
Right.
It's about finding the approach that resonates with the individual and their healthcare provider.
That's a great way to put it. It's about finding that balance between ancient wisdom and modern science, respecting both traditional practices and scientific evidence.
I love that. Finding the sweet spot where ancient wisdom meets modern science. It's about a holistic view of healthcare, considering the whole person and the full spectrum of options available.
It all comes down to empowering people to make informed decisions about their health and well-being.
Well said. We've covered a lot of ground today, from understanding the basics of anal fissures and fistulas to exploring different treatment options.
We have I hope this deep dive has given our listener valuable insights and a sense of empowerment when it comes to managing these
I
conditions.
hope so too. It's important to remember that you don't have to suffer in silence.
Right.
If you're dealing with any of these issues, reach out to a healthcare professional and get the help you need.
Absolutely.
Yeah.
There's no shame in seeking help, and early intervention is often key to a successful outcome.
You know, as we wrap up our deep dive into anal fissures and fistulas, I'm really struck by how much we've uncovered.
Yeah, it's pretty amazing what we've learned just by exploring those sources you provided.
It really highlights that there's no one-size-fits-all solution when it comes to health and well-being.
Absolutely. What works for one person might not work for another.
Right?
And that's why open communication with a healthcare provider is so crucial. They can help you navigate those options and really personalize the approach.
Yeah, this deep dive has definitely reinforced for me the importance of being proactive and informed.
Yeah.
It's about understanding your own body, seeking professional guidance, and making choices that align with your individual needs.
And remember, this journey of discovery doesn't end here. It's about taking what we've learned, doing your own research, and continuing those open conversations with your healthcare providers.
You've touched on something important there, the idea of ongoing learning and exploration. It's so empowering to realize that we can take control of our own health and well-being.
Precisely. And it's not just about seeking treatment when things go wrong.
Right.
It's about incorporating preventative measures into our daily lives to support long-term health.
Yeah, we talked about diet hygiene and stress management as key factors in preventing these conditions.
Those lifestyle choices can make a world of difference. It's about creating a foundation of well-being that can help prevent issues from arising in the first place.
One thing that struck me throughout our conversation is the power of combining ancient wisdom with modern science.
It is remarkable how traditional remedies like honey are now being backed by scientific research. It just shows that both approaches have something valuable to offer.
Yeah, and it underscores the importance of keeping an open mind,
Absolutely.
considering all possibilities, and finding what resonates best for each individual.
It's about creating a holistic approach to health and wellness that honors both traditional practices and scientific advancements.
It's been so inspiring to explore these concepts, and I hope this deep dive has been equally enlightening for you, our listener.
We've covered a lot of ground, from understanding the basics to exploring diverse treatment options and preventative measures.
Remember, knowledge is power, and you now have a wealth of information to draw upon.
If you're experiencing any of the symptoms we discussed, don't hesitate to reach out to a healthcare professional. They can provide personalized guidance and support.
We've only scratched the surface of this complex topic, but hopefully this deep dive has equipped you with the knowledge and confidence to navigate your own health journey.
Continue exploring, asking questions, and advocating for your own well-being.
That's it for our deep dive into anal fissures and fistulas. We hope you found this exploration insightful and empowering. Until next time, stay curious, stay informed, and take good care.